Hello, everyone. My name is Tiandra Batiste, and I will be discussing compensation and benefits for sonographers in hospitals. Learning objectives. What I learned while working on my presentation is employment outlook of a diagnostic medical sonographer and their responsibilities. I also learned how important they are as an allied health professional and the significant role they obtain in the workplace. What the audience will learn from my presentation is how their day-to-day routines affect employees' health, changes that should be made, and what should be done to ensure appropriate care is prioritized for a sonographer. Introduction. Diagnostic medical sonographers operate special imaging equipment to create images or conduct tests. The images and test results help physicians assess and diagnose medical conditions. Compensation and benefits include compensation/salary and awarded benefits passed on by an organization to its employees for their work performance. Because of the persistent movement of equipment for each individual patient, many injuries such as work-related musculoskeletal disorders are common for sonographers, as to why it is important to ensure proper compensation and benefits are available, because they help keep employee retention on track in order to maintain a productive workplace. Case problem and challenge. The biggest challenge with compensation and benefits is their coverage. Oftentimes, employees feel the process is unfair, inconsistent, or unreasonable. My case is relating to sonographers in hospital settings. Many are not appropriately being covered by employers for work-related injuries and are left with the damages. They also often impose a substantial personal toll on those affected since they may no longer be able to work or perform simple personal tasks and activities of daily living, causing workforce shortages and employee hardship. When employees feel as though they are receiving adequate care, they then increase productivity amongst the organization and become a benefit to both patients and employers. Case solution and approach. Surveys done on sonographers in hospitals found that not only does completing the diagnostic sonography scan on the patient increase risk to the worker, but completing the image data and reporting on poorly designed workstations contribute as well. The sonographers who were observed mentioned their frustration with adjusting many of the workstations, which points to the need to provide effective instruction to all employees from their employers. A combination of education and effective feedback techniques may be a model for continuous training for sonographers by management and therefore reducing their risk of workplace injury. Work-related injuries to sonographers are increasing due to busier schedules, which causes the sonographer to do examinations on more patients with less rest time in between, and exam specialization, which causes sonographers to use repetitive motions. The average incidence of sonographers scanning in pain is more than 80%, with 20% of these cases involving career-ending injuries. The surveys taken was an effective tool in developing ideas on how to improve employee health, the use of ergonomics, and employee benefits, which can effectively enhance the workplace. Conclusion. The case discussed is a perfect example of implementing new factors that need to be worked on and appropriate care for employees within the hospital. Compensation and benefits continue to change as new aspects such as technology and patient care continue to advance. It is vital for the sonographers and employers to work together to achieve a healthy work environment. It is also important for the employers to provide ergonomic equipment and work schedules that allow for rest time between examinations. The cost of implementing an ergonomic program is far less than that of having a sonographer miss work for injuries. This will maintain healthy work relationships amongst the hospital and ensure employees are made a priority. These are my references, and thank you for listening to my presentation.